and welcome to the Rational Living Show. I am your host, Dr. Aldo Pucci. This is a weekly show that is broadcast live every Wednesday at 7 p.m. Eastern United States time. I am president of the National Association of Cognitive Behavioral Therapists. I developed an approach to cognitive behavioral therapy that I call rational living therapy. Rational living therapy focuses on the fact that our thoughts cause our feelings and behaviors, not people and situations and things and events. I'm also the author of two books, The Client's Guide to Cognitive Behavioral Therapy, which is now in its second edition, and Feel the Way You Want to Feel No Matter What. And you can find both of those on Amazon.com. This is an interactive show, especially today's show, as it's a Q&A show. And so if you're listening on the Podbean app, I encourage you to call in using the Podbean app with your questions. Be glad to answer any questions you have. And if you're watching on YouTube or Facebook, X, or LinkedIn, you may type in your questions, your comments, and I will do my best to answer them as well. The title of this week's show is Anxiety, Questions, and Answers. And I want to thank you all for the questions that you sent in to me. But also, if you have questions, be sure to ask them during the show, and I'm glad to answer them. The first question that I'm going to do my best to answer this evening is from Jeanette. And her question is, she says, I have a question for you. How does a person get rid of the anxiety caused by traumatic events experienced in one's life and the waiting for the other shoe to drop? She says, the expectation that bad things will continue, the pessimistic belief that there will only be more negative events, traumatic events. She says there will only be doom and gloom in one's life, and one will not live happily ever after. Well, thank you, Jeanette, for that question. First of all, it all begins with the fact that our thoughts cause our feelings and behaviors, not people and situations and things and events. And so until a person understands that and accepts that fact, they will believe that their emotions and behaviors are dictated by situations and events. And so if things do not go the way they want them to, then they think they have to feel miserable. So it all begins with the fact that our thoughts cause our feelings and behaviors. Thank God for that. And not people and situations and things and events, no matter how bad those things might be. The second thing to consider and to keep in mind is anxiety is not caused by events. So therefore, when we feel anxious, we do not feel anxious because of the situations that we're experiencing or that we might have experienced, but because of the fearful thoughts we think about those situations. Another thing to consider is the fact, believe it or not, and I know this is contrary to what most people think, there is no such thing as a traumatic event. An objectively traumatic event. There's no such thing. Because if there were such a thing as an objectively traumatic event, then everyone would have to be traumatized, so to speak, when they experience that kind of situation or that event. And we know that's just not the case. Now, there's certainly some situations where people are more likely. And because what are we talking about when we're talking about trauma? What we really mean is a highly anxious reaction to something, right? To something that a person is afraid of. And so there might be certain situations or circumstances in a given society where many people or most people might react with anxiety if they experience that. But that's not the same thing as saying that this is objectively traumatic. Because, by the way, if we call the situation traumatic, then what we're saying is that that situation is what's causing our anxious feelings. And thank God that's not the case. It's our fearful thoughts about what happened, what's going on, about what we're experiencing that causes our anxious feelings or any other feeling for that matter. But then you bring up a point, and that is it's the meaning. And what I teach both therapists and folks who come for therapy is that these situations, whether it's a car accident or having been raped, or assaulted, or so many, or your house burns to the ground. These are situations during which we learn things. We learn we often learn problematic thoughts as we're experiencing these things. One is now the world is different. Now I know that my house can burn to the ground, or now I know that I can get attacked. And then when a person realizes that, then they start to think that it's likely to happen because it can. I've realized that it can happen. Now it's likely to happen. Therefore I better not leave my home, if I was attacked outside of the home, because if I leave home, I'm likely to get attacked. And then there is the idea, I couldn't take it, I couldn't stand it, I couldn't cope with it, I couldn't deal with it if in fact I were attacked. And so it's that meaning. What does it now mean for my life that this happened? What have I learned? What do I know now that I didn't know before? Well, what I know now, or at least I think I know, is that this kind of thing can happen to me. I realized that, getting raped could happen to people, but I didn't realize that it would ever happen to me. And now that it did, now it's kind of like now I flipped a switch in my mind, and now I believe not only is it possible, but it's likely. So therefore, we work at challenging these things. Number one, it was always possible. Secondly, as unfortunate as it is. Secondly, the fact that we're around to feel upset when we think about it proves that we coped with it, maybe not very well, but we're still around and we survived it, so to speak. So now it's a matter of learning how to feel better when we think about what happened, and to work at recognizing a true threat. Just how likely is it? Is it as likely to happen again as I think it is, because it happened once? And if it is more likely to happen than I care for it to be, or that I'm comfortable with, what can I do to work to prevent it in the future? So the idea that kind of walking around with like as if you have a black cloud over your head, just doesn't make good rational sense. But we understand, and it's not surprising when people think that, because they think that their emotions and behaviors are dictated by what they experience. You see, and so it's that expectation that my life will always be bad because it's happened. This is likely to happen again, and different ideas like that we work to help people to correct, and thank God that they can and they do, with the right instruction, the kinds of things that we teach in rational living therapy. Okay, so thank you very much for that question. Okay, it looks like we have a question. Said, I had 2 panic attacks recently. How does one get rid of the panic when one is panicking, like queasy, weak legs, feel about to faint, etc.? Oh no, I'm panicking. It's awful, horrible. And so, well, one of the things we talked about this actually last week, I encourage you to check out last week's podcast, I think you might find it very helpful. But one of the things that's problematic is when people panic is thinking that they have to fight it, and that and so the act of fighting against panicking actually makes people even more anxious. And especially when they have this idea, I can't stand it, I can't take it, I need not feel this way. So this is what we call distress intolerance in rational living therapy. Distress intolerance. It's being upset about being upset. And so what tends to happen is people will panic over something, and then they will, because it felt so uncomfortable to panic, they then start panicking over the possibility that they might panic. And that's usually what helps to maintain or make it persist panic, is the fear of panicking. And then what makes matters even worse is when people try to avoid it or escape it, because then it's negatively reinforced, that escape. But doing so helps to reinforce this idea that I can't take it, because if I could take it, I wouldn't be trying to avoid it at all costs. So one of the best things that a person can do is work at being unafraid of panicking. As we've talked about before many times in the show, taking panic out of the category of life-threatening and putting it into the category of unpleasant, uncomfortable, where it belongs. Okay? All right, terrific. We have another question that was sent in by Martin, and he asks, what if my anxiety never goes away? What if I'm stuck like this for the rest of my life? Okay, now, we in rational living therapy, we very much pay attention to the words that people use. Notice what is said here. Thank you for that question, by the way. What he says is, what if my anxiety never goes away? So how people often describe anxiety is as if it's this thing that dwells within them. See, there's this thing that dwells within me called anxiety. And every now and then anxiety comes out. And I don't know how to get rid of it. So people will often view it as being like having the flu. There's only so much you can do to make yourself feel better once you have it. And so the logical question is, how do I get rid of it? But if they think it's not something that you get rid of, it's something that dwells in you, then they're always waiting for it to come around again, for it to come out again. And so there isn't this thing that dwells within you called anxiety. What causes anxiety is fearful thoughts about whatever it is the person's aware of. Okay, so therefore, there's no such thing as being permanently stuck in anxious feelings. There's no such thing as not being able to rid yourself of the anxiety-producing thoughts. So when you think about, you wouldn't say, "What if I'm stuck walking across the room?" You said, "Well, what are you talking about?" All you would do is just stop walking across the room, right? But the difference is you know how to stop walking across the room. If you don't know how to stop being afraid of something, then you will think that it's the correct thing to do to be afraid of it, and you will continue to be afraid when you think about it. So therefore, it's a learning process. But it begins with the fact that our thoughts cause our feelings and behaviors. So instead of referring it to my anxiety or the anxiety, it's better to think about it in terms of I feel anxious when I think fearful thoughts. So now what I'm going to do is work at examining those thoughts, challenging those thoughts to see, does it make rational sense for me to be afraid to the degree that I am, or even at all? Okay. All right, terrific. Let's see over here if we have, okay, good. Now remember, you can also call in with your questions. Yes, if you're using the Podbean app. Okay, we have another one from Cynthia, and she asks, "What if I faint during a presentation?" So, what if I'm giving a presentation and I faint during it? Presumably from feeling anxious, right? Well, keep in mind that it is very rare for a person to actually faint or pass out from feeling anxious. If a person does, then it would be a good idea to get medically evaluated because you might have a problem with blood sugar, for example. You might be hypoglycemic, for example. Okay, but otherwise, the reason why people generally do not faint when they feel anxious is because to faint, your blood pressure has to drop. Okay, but when you feel anxious, what happens to your blood pressure? It rises, right? So therefore, but the reason why people feel like they're going to faint is because of that higher blood pressure. Okay, usually, mainly. And so that's the first issue. It's not very likely at all that a person will faint when feeling anxious. But then we have to look at, it's important to answer that what if question. What if I do faint? Then what? What am I afraid of will happen if in fact I do faint? Well, the one thing that it would prove is that you are a fallible human being just like everyone else, right? So if a person or if you're Cynthia afraid of the embarrassment of passing out in front of everyone, well, there are many reasons why a person might pass out, but regardless of that, it would just prove that you're a fallible human being just like everyone else. And if they think it something to be critical of, then they aren't paying attention to the fact that they're fallible human beings themselves. Okay. And now, of course, sometimes people are concerned that, well, if I faint in front of this group, there's no one's going to help me. Well, that's very unlikely as well. Okay, but even if they don't, eventually you'll regain consciousness and be just fine. All right, the next question is from Bert, and he asks this: when my heart races, I immediately think something is medically wrong. How do I stop assuming the worst? Well, the best way to do it is with evidence. So the first rational question, there are three rational questions. Is my thinking based on fact? Does my thinking help me to achieve my goals? And does my thinking help me to feel the way I want to feel? So with that first rational question, is my thinking based on fact? What we're emphasizing is the importance of making certain that indeed your thinking is based on fact, because if it's not, then you're not dealing with what is, you're dealing with a fantasy rather than reality. See? So keep in mind that in rational living therapy and most other cognitive behavioral therapies, we are not promoting optimistic thinking. What we are emphasizing and recommending is rational thinking. So if a person's heart races, could the cause be a physical cause? Could there be something wrong with a person's body to cause their heart to race? Certainly there could be. So therefore, it's important that, if you experience this regularly, to get checked out, to see if there might be something. Perhaps there's a problem with the thyroid, a problem with the adrenal glands, or blood sugar problem or something, anemia that's causing those symptoms. Get it checked out. But once you're checked out and if everything looks fine medically, then base your thinking on what the facts actually are. And so therefore, if the evidence shows that you're just fine physically, that if your heart's racing, it's probably anxiety, you're afraid. And what's likely happening is your heart starts to race for whatever reason. and then you make yourself anxious about it, which then causes your heart to beat even more rapidly and probably harder as well, uh, then that just compounds matters, right? It makes matters worse. So, so, but then of course you also want to work at challenging the fear of there being something wrong with you, meaning not only just what is the evidence, is there something wrong with you, but what would that mean if in fact there were, okay? Because if something's wrong with me, then I might have to have an operation, and I couldn't take that. I couldn't stand it, or I might die, and my family will starve if I do. Yeah, let's get to the underlying assumptions that cause the anxiety, the fear, and work at correcting them. Okay. All right. Louise actually asked two questions. One is, should I avoid places where I have panicked before? And so let's look at that first. Should I avoid places where I've panicked before? And the answer is absolutely not. First of all, it's unlikely, it's never the situation that causes us to panic. But often situations are kind of a victim of circumstance, in the sense that the situation really had nothing to do with why you panicked. You really weren't reacting to it. Perhaps something else was on your mind, you see. But sometimes it is the case. You're in the woods, you turn around and a bear's ready to attack you. You very well might panic in reaction to that. So in that kind of situation, if you actually are in danger, then you might want to avoid situations like that, obviously. But typically, the problem with avoiding avoiding other situations where you're not really in danger, but you're acting as though you are, is that that produces negative reinforcement, meaning avoiding it takes away something that you don't want, and that's those anxious feelings, which then reinforces the idea that there must be something to be afraid of, otherwise I wouldn't be avoiding it. Okay, so avoidance is fear's best friend. Fear just loves avoidance, because if you never step on an elevator, you don't give yourself a chance to see that it won't get stuck between floors, or even if it does, that you will not suffocate. I don't think I've ever seen an airtight elevator before. Okay. All right. Great question. And the second is, why does trying to calm down sometimes make it worse? Well, because often people try to forcefully calm down. And often the reason they try to forcefully calm down is because they think they have to. I can't stand feeling anxious, and I have to calm down. And so their fear that they won't calm down compounds that as well. So I'm trying to calm down, and it makes matters worse. Okay, so instead, if a person has a more relaxed approach to calming down, meaning I am going to work to calm myself down, but if I'm not successful, I'll be okay, because the way I'm feeling will not kill me. It's only unpleasant, uncomfortable. Right? Okay, someone asked, what breathing exercises have you used with patients? In terms of calming, one of the things that you can do is breathe in for 4 seconds, 1001, 1002, 1003, 1004, and then exhale for 6 seconds. Okay, with just a very brief pause between, that 6-second exhale helps to activate your parasympathetic nervous system, which helps you to calm down. Okay, so the idea, I have to calm down, I must calm down, is usually what makes it very difficult to actually calm down. Okay, so my preference, I prefer to feel more relaxed and calm, but I don't have to. Okay. All right, now Tristan asked this. I feel like everyone is judging me. How do I stop caring what people think? Okay, now, the way you stated this is a very common way to state this concern. But one thing to keep in mind is there is no such emotional feeling as everyone is judging me. So, what you really mean is, I think that everyone is judging me. It seems at times that everyone is judging me. Okay. And so that's a very important distinction. And matter of fact, we can have an entire show just on that distinction sometime. So that's the first thing. Sometimes it seems as though everyone is judging me. But then how do I stop caring about what people think? Well, there are two things to consider. The first of all is what people think matters not one iota to us, because their thinking is only their mental activity. And their mental activity by itself does not affect us. Their acting on their mental activity might, but not their mere mental activity itself. Okay. So someone can think all he wants, I think I'll shoot Aldo. As long as he doesn't do it, I'm just fine, right? However, if he were to act on that thought, that might ruin my day. So, therefore, the point. So that's the first thing to keep in mind. If they are only thoughts that people are keeping to themselves, even if they're very negative thoughts about you, but they don't treat you as if they have a poor opinion of you, then who cares, number one? And secondly, how would you ever know it if they're keeping it to themselves? So therefore, what I recommend is that rather than trying to do something that you cannot do, and that is read a person's mind, to actually know what they're thinking, go with how they're treating you, right? If they're treating you in a way that you dislike, point that out to them. Rather than accusing them of motivation that you cannot prove and they cannot disprove. How could you ever prove to someone that you weren't thinking something? You can't do it. Stick with the behavior. I noticed that you acted this way. I'd rather you not act that way toward me. And perhaps, could you please, act differently? And perhaps in the process, they might say, well, the reason I acted this way was because of this. But, to accuse them of motivation that you cannot prove is just, not only is it a waste of time, but it can create problems, unnecessary problems. Okay. And also, by the way, not everyone's, not everyone's acting on their opinion will matter equally, right? So if I go conduct a training somewhere, and people do not like, my training, that might have very limited effect on my life. If those people dislike something about me and don't want to associate with me in the future. However, if my wife decides that she no longer likes me, then that would have a much greater impact on my life. Otherwise, doesn't mean I have to make myself miserable about it, but practically speaking, it would have but what do people tend to do? They act as though everyone matters equally to them in their life. That everyone's opinion matters equally. And practically speaking, that is just not the case. Okay. Tristan also asks, is it normal to avoid social events just to prevent anxiety? Yes, it's normal in the usual sense. In other words, people, many people do that. If you do that yourself, Tristan, you did not invent that by any means. That's been around since there have been people. but that does not mean that it's a rational thing to do. And as a matter of fact, um, each time you do it, you're reinforcing the idea that being around people is something to fear. Okay. And so the best thing to do is to work at challenging the thoughts that cause you to be afraid about situations like that. And also to put yourself in those situations to prove to yourself that even if you do feel anxious, you'll be all right. You are okay. Right? All right, great. The next question is from Janice. Actually, she has two as well. The first is this: is worrying actually helpful in preventing bad things? Now, we talked about this in one of the podcasts, and the answer is absolutely not. The idea that worrying prevents things is what we call magical worry, or what my mentor, Maxime Maltzby, used to call civilized voodoo, okay? Because rarely do those things that we worry about actually happen. So after a while, a person notices this pattern. If I worry, it doesn't happen. If I worry, it doesn't happen. Until after a while, a person becomes afraid not to worry because it's as if that worry kept bad things from happening. But what we know is that worry is only mental activity. And that kind of mental activity does not affect the environment at all. Acting on mental activity might, but not mental activity itself. Okay. Which then leads us to the next question she asked. If I stop worrying, won't I be unprepared? No. See, worry is just something that a person does that gives them the impression that they're doing something about their situation, right? Well, at least I'm worrying about it. But as we say, worry is like rocking in a rocking chair. It gives you something to do, but gets you nowhere, okay? So what we recommend is replacing worry with concern. So know what you want for yourself, for your loved ones, your well-being, their well-being. If it seems like something is threatening your well-being or their well-being, be concerned and then act on that concern. Okay? That will help you to be prepared. That concern, perhaps planning, but mere worrying itself will not in any way. Okay, great. Now, another question, and by the way, if you have questions, be sure to ask. Let's see here if we have any. Okay, someone asked, what supplements have some of your patients used to successfully reduce daily anxiety levels? Well, some things that can be helpful, and keep in mind it's important to talk to your doctor, your pharmacist about anything that you take, really. One very effective supplement is valerian root. Okay, valerian root can pack quite a punch in helping to make it more difficult to feel anxious. However, let me caution you about something. And also ashwagandha, these adaptogens have been helpful as well. Chamomile tea can be helpful. But let me caution you about something, and that is that they only make it more difficult for you to feel anxious. I've had people who've taken Xanax, for example, a powerful anti-anxiety medication, high doses of Xanax, ask me, why am I still panicking even though I'm taking all the Xanax? So I would ask them, imagine you're standing out in the middle of the road here, and a car is coming toward you, at 100 miles an hour, getting ready to run you over, to flatten you like a pancake. How much Xanax would you have to take to not feel anxious about this car about to run you over? Right? You'd have to be practically in a coma from it. So these medications, these supplements can make it more difficult for you to feel the effects of your fearful thoughts. But if you're you're making yourself afraid enough, they're going to be of limited usefulness. Let me put it this way. Okay. Okay. Joe asks if I feel like I must perform perfectly, or no, he says, I feel like I must perform perfectly or I failed. How do I loosen that pressure? Well, the first thing is to realize, as we talked about with Tristan, that what you really mean is, I think that I must perform perfectly or I have failed. Okay. So you ask, well, how do I loosen that pressure? Well, the first is to ask yourself, well, what are my goals? What am I wanting to achieve? So I think I have to perform perfectly at this task. What is my goal? What am I hoping to achieve with this task? And then, does that goal require perfection, or does that goal require adequacy? See? So just what are the requirements to achieve that goal? What does it take to achieve it? And so rarely is perfection required to achieve a particular goal, except the goal of perfection. Okay? Another problem with that, with the idea that I must perform perfectly, is that often people have no idea how to define perfection. So I must build this cabinet perfectly. Okay, well, what would a perfect cabinet look like? Well, gee, I don't know. All right, so therefore, how would you possibly know when you've built a perfect cabinet if you don't know how to recognize one? You see the point? Or, I have to have this perfect look, or now sometimes a person might say, well, it's easy to find perfection. I get all answers correct on the exam. That would be a perfect score. Okay, yeah, that might be a little easier to define. The question is, to achieve your goal, do you have to have a perfect score? Or do you have to have an adequate score in relation to your goal? Okay. And then, of course, the other thing is examining just why do I think it must be perfect, whatever that means, and what is the result? What do I think will happen if it's not perfect? The bottom line is that however we define perfection, because we are fallible human beings, we're not perfect. Eventually, we will mess up. No matter how good we are at something, no matter how skilled we are at something, sooner or later, eventually, we will make a mistake because we are fallible human beings, period. Okay? So thank God that most things in life do not require perfection, some kind of absolute perfection. All right, Joe also asks, is avoiding anxiety triggers actually making my anxiety worse? And the answer is absolutely, because of what we talked about before in terms of avoidance. And avoidance is fear's best friend. So the best thing you can do is to actually expose yourself to those things that you are irrationally afraid of. Now, it doesn't make sense to expose yourself to the things that you are rationally afraid of. In other words, you're in an airplane and someone's trying to push you out. Of course, you're going to try to grab onto whatever you can to keep them from doing that. It wouldn't make any rational sense to think, well, he can push me out and I can flap my arms like a bird and land safely on the ground. That would be kind of silly, wouldn't it? So yet those things that we are irrationally afraid of, one of the best things we can do is expose ourselves to those things. Okay. All right. Let's see. Is anyone? All right. Just let's do one more question here. and that is, let's see what. Um, Dana asks, I Google symptoms constantly. Why can't I stop? And then she also asks, how many medical tests are enough before I accept I'm okay? Okay. So the first, I Google symptoms constantly. Why can't I stop? Well, the fact is you can. You refuse to stop because you think, for some reason, you think it's important to, right? That it's a necessity. Otherwise, you likely would talk yourself into stopping. There's probably a magical worry component to it that I have to worry about this, but yet if you compulsively look for information, Googling or AI or what have you, you're probably trying to reduce your anxious feelings by finding evidence that, to try to reassure yourself that you're okay. But then you also want to examine your fear of being ill and possibly of dying. So what am I afraid of here? Why am I afraid of being ill? What do I think will happen if I'm sick? Or what do I think will happen if I die? So therefore, that kind of behavior of compulsively checking your health is often the result of a fear of being ill, and the result of being ill is what I'm trying to say, or the result of dying. And it's important to examine that and to correct it. But then in terms of how many medical tests are enough before I accept that I'm okay, well, the question is just how much evidence is required to be satisfied. It's really based on the fear of not being okay. Because what people often want or think they have to have is a guarantee. You see, I need a guarantee that I will, that I'm okay. I have to have a guarantee that I'll be okay. And so therefore, this test result hasn't given me a guarantee, and that test result hasn't given me a guarantee, and neither has the third. But the fact is you don't need a guarantee. What's important to do is to work at that fear of what will happen if I'm not okay. It's kind of like people think that they have to have a guarantee that the airplane that they step on will not land prematurely, will not crash. Well, there is no guarantee. It's because it's possible that the plane will crash. They have before, unfortunately. So when working at overcoming that fear, it's important to work on why am I afraid of dying to begin with? Just what do I think will happen to me, or perhaps to my loved ones, or what have you, and work that out. Now, of course, once you do, and you are unafraid of those consequences, accurately assess what the consequences are likely to be, and you're unafraid of those things. That doesn't mean you'll be reckless. That doesn't mean that if you're at the gate waiting to board the plane, if you look out and you see that one of the wings is just barely hanging on, it doesn't mean that you're going to say, well, I'll get on the plane anyhow. No, you'll still have sense and avoid getting on the plane if it looks like it's dangerous. But otherwise, by working at correcting those fearful thoughts about dying, for example, then you will put yourself in a much better position to make use of the low probability, to take advantage of the low probability of the plane crashing. Or in this case, if you have a stress test for your heart and it shows that you're fine, and especially if you have one that a nuclear stress test where they can see the blood flow in your heart and everything looks fine, then you very well might say, well, since I am no longer afraid of dying, I'd like to avoid it for the time being, but since I'm no longer afraid of it, I will be satisfied with this information that they gathered, from the test. So it's otherwise, no evidence will be enough because a person thinks they have to have a guarantee. Okay, someone said conquering fear of death, one's own death, using RLT would be a good podcast topic. Yeah, I think so. Yeah, for sure. Thank you for that suggestion. All right, let's see here. Make sure. All right. Well, thank you all so much for tuning in and watching the podcast. And our Rational Living show is streamed, that is, every Wednesday, 7 p.m. Eastern. And you can watch the replays on YouTube and listen to it wherever you listen to podcasts. I'm Dr. Aldo Pucci, and I thank you so much for your support. Looking forward to seeing you the next time. Bye now.